Hi, my name is Miranda Stuvey, and I'm going to lead a discussion on chronic fatigue syndrome. So we're going to start out with a basic definition and overview of what chronic fatigue syndrome really is. What is chronic fatigue syndrome? This is a complex disorder characterized by extreme fatigue that lasts for at least 6 months. It can interfere with daily activities and lifestyle choices. There are a couple different names that can identify chronic fatigue syndrome, but they're not as popular. A major attribute of chronic fatigue syndrome is that any physical or mental activity causes extreme fatigue to the person. It also means that even when they get rest, they see no improvement in the fatigue. So, how does chronic fatigue syndrome develop? This is a difficult question to answer as doctors are not really sure how it exactly is caused. There are a couple different theories that are used in order to kind of explain how it is brought about. One important one is viral infection. So this means if a person develops Epstein-Barr or some disease along those lines, the shock of the disease can cause chronic fatigue syndrome. Another way that you can get it is through psychological stress or an immune system deficiency. A lot of times, cases that you see chronic fatigue syndrome, the patient has some kind of immune disorder. Another way you can get it is through hormonal imbalances. This means that the blood hormone levels produced by the pituitary gland or adrenal gland or hypothalamus aren't balanced right, which can cause major fatigue to a person. Another big one is exposure to toxins. Different exposures to different chemicals or anything like that can cause fatigue that'll make a person develop chronic fatigue syndrome. It's also possible that a traumatic event or experience can cause it. Who develops chronic fatigue syndrome most often? So a lot of the times it develops in women. It's not that it only develops in women, but it's definitely more common than in men. You also see it in the mid-age range, so around 40s and 50s. It's still possible to develop it earlier on or later in life, but this is just the most common time frame in which it occurs. There are a couple complications that are related to chronic fatigue syndrome. These include depression, social isolation, lifestyle restrictions, as well as an increased work absence. This means that with the chronic fatigue, people stop interacting in social situations, they don't have the energy to go to work. It just affects their lifestyle in so many ways. Like I said, a big part is also depression because there's just no energy, so they feel like there's just constantly this sad feeling because they can't do anything. So what are some signs and symptoms of chronic fatigue syndrome? This is a big category because a lot of the signs of chronic fatigue syndrome overlap with other basic diseases that we have in the community. Some of these include fatigue, loss of memory, a sore throat, swollen lymph nodes, headaches, anything like that. Stuff that when you go to the doctor, it could be any different disease. So it's hard to diagnose because you can have symptoms that match up with the common cold or the flu, and it takes a lot of time to figure out if it actually is chronic fatigue syndrome or not. So like I was talking about, the diagnosis for chronic fatigue syndrome is pretty difficult. You can't go in for a single test and say, okay, I have chronic fatigue syndrome. It's a situation where the doctor must run multiple tests to disprove that you have another disease. So they go through and make sure that you don't have a sleep disorder or a medical problem or some kind of mental health issue that could be causing the same symptoms. There's no test that they can run to say definitively that you have chronic fatigue syndrome. It's more of a patient process in order to cross out other options that it could possibly be. So how do you treat chronic fatigue syndrome? There's no medication that you can take that'll make chronic fatigue syndrome go away. This is because there simply is no cure. The only thing we can do is to help make the symptoms more bearable for daily activities. Some of these include antidepressants. What these do is they can increase concentration and also help with sleeping, which can help put down some of the symptoms of chronic fatigue syndrome. You also have sleeping pills and pain relievers or anti-inflammatories. These, like they say, can either help increase your sleep or they take away some of the pain in the muscles and the joints. That is another huge symptom of chronic fatigue syndrome. A lot of people will have pain in their muscles and joints, and it won't be swelling necessarily, but they'll feel this deep pain, and the pain relievers and anti-inflammatories can help with that. In severe cases, you can also use narcotics, but these try to be avoided just because of their addictive components. We don't want to use them unless the patient really can't function because the pain is so severe. You can also use anticonvulsants. What these do is they kind of take away some of the fatigue and the pain as well. So it's an anti-seizure medication, so sometimes people wonder how it can help with chronic fatigue, but it helps to take away the pain and definitely make you feel like you are less tired. Like I said, there's no cure, and in a lot of cases you'll also see psychological counseling that's utilized in order to help people better cope with their problems and better understand how to function with the limitations that they have because of their disease. So for my case study, I have a female patient who's 47. She's a non-smoker but has a sedentary lifestyle. She has a normal blood pressure, a normal fasting glucose and total cholesterol, and she has a BMI of 22, which is in the normal range. Based on the history I gathered, she also has no family history of illness. She has been diagnosed with chronic fatigue syndrome, and she's taking venlafaxine, which is an antidepressant. So with this antidepressant, it should be helping to give her more sleep as well as a little more concentration to help lessen the fatigue, but it also can have some side effects which we'll take into consideration when designing the program. So based on the history that I found, her risk stratification shows that she's generally a healthy client. She doesn't have many health problems or things going on that make her more susceptible to having a cardiac episode during exercise. This is a good sign, so that way we can purely look at the effects of her disease when we're designing a program that'll be beneficial for her. We don't have to take into account the abilities that she might have a heart attack or some kind of cardiac episode due to having a high risk stratification. This being said, she gets put in the low risk category, and we just pay attention mostly to the fact that she has chronic fatigue syndrome. So a couple clinical considerations that we want to pay attention to. We want to make sure that we're not doing anything too strenuous on the muscles. Seeing as though the disease may cause pain to the muscles and joints, we don't want to make that pain any greater than it already is. We also have to pay attention to orthostatic instability. What this is it means that anyone who's been diagnosed with chronic fatigue syndrome runs the risk of getting dizzy or lightheaded when standing for too long of a time. This means that we'll want to avoid things that put them in an upright, erect position for long periods of time, just so we don't have any negative side effects during exercise. We also want to watch that we're not overdoing it or pushing too hard each day for the exercises. We don't want them to come in feeling good and then the next day have them feel worse because they did too much and it caused them too much fatigue for the next day. We always want to have a brighter tomorrow than the day we came in. We also want to make sure we start slow because she does have a sedentary lifestyle coming into it. We don't want to start out by putting too much pressure on her body that makes her even more tired. We're also going to watch out for the possible dizziness and drowsiness due to the medication venlafaxine that she's taking. It's only seen in some cases, but it's still something we're going to want to look out for. There's also the possibility that she could run the risk of having an elevated blood pressure, so we're going to want to keep an eye on that probably before and after exercise, just to make sure it's not too elevated out of a healthy range. So as far as exercise testing would go for this patient, I would not perform a max test for testing only because I do not see that we will be using any weights that are close to a max test. Most of the exercises she'll be performing will be functional movement and range of motion training that will help with strength, but mostly just get her body moving in the way it should. So I don't see the need of stressing the body and the muscles and joints to perform a max test. So like I said, we'll be using some basic movements, and these will help to determine her discomforts, abilities, and help see what pains her and what makes things more uncomfortable. So this being said, I'd use a sit to stand test, which would be just standing up out of a chair, a sit and reach to test flexibility, as well as a push-up or modified push-up depending on the pain or the abilities, and other stuff like that, possibly a quadruped opposite limb test in order to look at muscle coordination and core strength, anything like that that'll help determine her functional capacity at this time and see if there's a way to improve that without causing greater side effects. So for her exercise prescription, we'd start with an aerobic training. This will be very light considering she's a sedentary person at the time and she has the muscle and joint pain sometimes. We want to make sure that we don't use too much energy, so like I said, she doesn't have a worse tomorrow than the day she came in. So I'd probably start out with 1 time per week for no more than 20 minutes of exercise. This gives her the opportunity to have aerobic training, but it doesn't push too hard that her body will become more fatigued. I'd probably say starting out in a pool in a light aerobic or light swimming scenario where the pressure isn't on her muscles from standing or intense impact on the bones, but she still gets that cardio in from swimming. Then I'd move on to stretching. This could be performed about 4 times a week. We'll start with some basic movements that help with range of motion, stuff like that, and it'll be exercises. They'll be held for 30 seconds and repeated 3 times. You can perform the basic tests like feet together, reaching for your toes, single leg, butterfly, stuff like that. There's also stretches for your back like open books and thoracic spine stretch. All of these will help to loosen up her muscles and give her the range of motion that she really needs without putting tons of stress on the body. Once we finish with stretching, we can move into some range of motion and strength training. Like I said earlier, we're not going to want to use anything that's too heavy weight, only because it'll put a lot of strain on the muscles. This is something that we can increase the weight as we move through the program, but the first couple weeks are going to be really light in order to go through the motions and make sure that we're moving at a slow enough pace not to cause more fatigue. So we'd say this would only be performed about twice per week, giving her enough recovery so that the muscles aren't too sore or fatigued the next day. This would also include functional movements, so not as much resistance exercises on machines or stuff like that, but use a low step and do step-ups for a short amount of time, or the sit-to-stand test, trying to use no hands and stuff like that, as well as you could do a farmer carry, just stuff that doesn't have a lot of weight, but that has strength and that range of motion working. So how would I progress her program? Of course, the first couple weeks would start really light. We want to work her into the program. We don't want to scare her away by thinking that any exercise is going to cause her more fatigue than the fatigue she already has. We don't want to scare them away and make them think exercise is going to be a bad thing for them. So we'd start really slow, and then we'd slowly progress into a little more weight and a little more aerobic training. This would occur at a pace over weeks and months, just to make sure that she didn't have a worse next day. We want to make sure that every day she comes in, she's feeling better than she did when she left. So in order to do this, we'd need to increase the weight, increase the cardio, but only to get increases and not setbacks. We don't want to cause any more problems than are already there. So this concludes my project. Hopefully it gives you a better insight into chronic fatigue syndrome and the ways that we need to work through it in order to help the patient in the best way without causing even more medical setbacks than what they already go through with the actual disease. Thank you.